Imagine waking up every day with a constant nudging pain that doesn't go away. It's not just a sore muscle or a fleeting headache. It's a pain that affects every part of your life and leaves you feeling frustrated and exhausted. Whether it's the aching joints of arthritis or the burning sensation of nerve pain, chronic pain is not just a physical condition, it can affect your mental health as well. But don't give up. Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Michelle Krichbaum, Clinical Manager of Pharmacy at Baptist Health, are the docs on call, and they're ready to answer your questions about chronic pain on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
I'm Kathy Buccio, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. But first, welcome to our amazing doctors, Dr. Camejo and Dr. Krichbaum. Now, we have our first question from Samuel, who reached out to us through our website, allhealthtv.com. And he wants to know, hi, Doctors Camejo and Krichbaum. My father has developed diabetic neuropathy, and his endocrinologist has put him on something called Cymbalta, which I know for a fact is an antidepressant because I've seen the commercial about a million times. He's in chronic pain, so shouldn't his doc put him on a painkiller like Vicodin? Now, doctors plural, because I'm no doctor, just like to play one on TV, but I am curious as to why Samuel's father would be prescribed an antidepressant. Dr. Camejo?
So, Kathy, it's completely understandable why you and Samuel would have this question. So first, there are two types of pain, nociceptive and neuropathic or nerve pain. So diabetic peripheral neuropathy is a type of nerve pain, and we use medications differently based on the type of pain we're having. Now, opioids like Vicodin can be very helpful for acute nociceptive pain, but they're not very helpful for nerve pain. So Cymbalta is like an antidepressant that kind of belongs to drugs called selective serotonin and neuroepinephrine reuptake inhibitors. They're called SNRIs, and it's thought to work by increasing serotonin and norepinephrine levels in your brain, which help regulate the pain. Now, even though Cymbalta is used to treat depression and anxiety, it also helps reduce both types of chronic pain, muscular, skeletal, like low back pain, or nerve pain like diabetic peripheral neuropathy, which is what your father has. So diabetic neuropathy can be difficult to treat because it doesn't often respond to conventional painkillers or any other antidepressants. So Cymbalta is especially helpful for people with diabetic neuropathy because it will help relieve the stabbing, burning, and tingling sensation. And make sure he's on a dose of 60 milligrams a day. And if it's not working for him, then go back and see the doctor.
Now, heads up, docs, we got pain question from Ahmed. Are you ready?
Right.
He's reached out through us through YouTube, and Ahmed wants to know, Dr. Camejo, my mom's got one of those irritating bowel diseases that I can't pronounce, but I know it begins with a C. Anyway, she's in a pain a good chunk of the time. So does that mean she has chronic pain? And if so, what can she do about it? Doctors Camejo and Dr. Krichbaum, could that be, it could be colitis or it could be Crohn's, if I'm not mistaken.
Kathy, you might just be right. Are you considering going to med school?
I'm going to join you and Dr. Krichbaum, so please make room for me there.
Ahmed, thanks for reaching out, and I'm going to be happy to answer your question. But before I do, let's check this video out from the Mayo Clinic.
I do have a headache every single day. I wake up with one and I go to sleep with one.
For 10 years, Allison Fleming has endured chronic headaches. The daily headaches and migraines, plus pain from other medical conditions, slowly eroded Allison's quality of life. It affected everything. She felt caught, trapped by unyielding pain.
I didn't know how I could possibly manage this amount of pain.
Unwilling to let the pain dictate how she lived, Allison went to Mayo Clinic, where she enrolled in the Pain Rehabilitation Center, a 3-week outpatient intensive program designed to help people suffering from non-cancerous chronic pain regain control of their lives.
You can improve your level of physical and emotional functioning. And then when you improve management of chronic pain, oftentimes pain severity or pain intensity will improve. However, that's not the primary goal.
Dr. Michael Hooten says there's sometimes no cure for chronic pain, so the goal of the program is to give people the tools they need to manage it.
To regain controls back over their life that the chronic pain has taken away.
Dr. Cynthia Townsend and Dr. Hooten team up with physical therapists, occupational therapists, nurses, and other specialists to help with all aspects of chronic pain. Things like group sessions, exercise, biofeedback, and support from others going through the same thing boost confidence. Patients learn that they can taper off medications. They can craft a plan to turn painful days into fulfilling days. They can stop pain from running their lives.
I've had people that come into this program, they're in a wheelchair or a walker, they're very difficult for them to move around, and as they graduate from the program, they've got their mobility back, they're active, they're engaged in life, they're enjoying life, they're laughing again.
Allison still has a headache every day, but the pain is no longer all-consuming because she's learned how to manage it.
I felt like I lost a little bit of myself over the past 10 years, and now to be back to where I was is very fulfilling.
For Mayo Clinic News Network, I'm Vivian Williams.
Well, Dr. Krichbaum, what advice would you give Ahmed?
So Ahmed, if your mom is experiencing pain that's lasted for longer than 3 months, then she could be diagnosed as having chronic pain. Colitis and Crohn's specifically are diseases of the gastrointestinal tract, and they can result in pain acutely during a flare or on a chronic basis. So if this is the case, I would recommend that your mom works with her gastroenterologist to treat the underlying condition, and that will hopefully result in a decrease in her chronic pain.
Thank you so much, Dr. Krichbaum. Now we got another allhealthtv.com question, and I love it. It's from Ophelia, who asks, hello, Dr. C. We just found out that my husband, Will, is suffering from rheumatoid arthritis. He has chronic pain that's more of an ache than a throbbing pain at this juncture. Being that he once had a substance abuse problem, he doesn't want to rush into any hardcore pain meds like opioids just yet. Our question is, are there any non-prescriptive therapies he can use for the time being? This is a great question. I've always wondered what folks with addictive personalities can use for pain relief, especially if there is a history there, Dr. Camejo.
So Kathy, I agree. This is a great question. And Ophelia, thanks for reaching out and sharing your story with us. But before I answer, let's check out this video from the Mayo Clinic.
50 million. That's how many people in the U.S. suffer from chronic pain. Many turn to opioid painkillers for relief.
The evidence is not at all clear about the efficacy of these drugs long-term for chronic pain.
Mayo Clinic pain management specialist Dr. Mike Hooten says what is clear about these painkillers is the risk associated with taking them.
The problems of addiction, but also a related problem of accidental overdose deaths.
Morphine, oxycodone, and hydrocodone are commonly prescribed opioids. Dr. Hooten says they are very effective when used short-term for pain, for example, after a surgery. For long-term use,
there are a smaller group of studies that may show some benefits in certain highly selected groups of patients.
But for many cases of chronic pain, Dr. Hooten says non-opioid pain relievers combined with other therapies such as stress management can help people manage pain and maintain a high quality of life. For the Mayo Clinic News Network, I'm Vivian Williams.
So Kathy, this is a fairly common question, and data almost says that half of the adults are already using some kind of complementary or integrative treatment for their chronic pain. And there are different options that are shown, and it'll be shown on your screen. So non-prescriptive therapies, one would be osteopathic manipulative technique, or OMT, and that benefits low back pain. And usually this is a hands-on therapy used by osteopathic physicians, aka DOs, where they use gentle pressure to manipulate the muscles, soft tissue, and joints. So there's evidence of benefit in low back pain, neck pain, and headaches. Second would be acupuncture can help with many types of chronic pain, including arthritis of hands, knees, and hips, as well as cancer-related pain. Yoga would be recommended for knee and hip arthritis and low back pain. Tai Chi is strongly recommended for hip and knee arthritis, as it also increases flexibility, muscle strength, balance, and lowers pain and stiffness, and really improves fitness and cardiovascular health. Last but not least, one of the last twos would be physical therapy, which can also is a good option to learn strengthening exercise and increase your range of motion if you're dealing with chronic pain. And then chronic chiropractic care, which has evidence of reducing and benefit for reducing low back pain. Now, also taking a supplement for at least 6 months of glucosamine or chondroitin. These are long sugar chains that make up cartilage in the body, so that the theory, ingesting these may stop the breakdown of cartilage and restore lost cartilage, especially in places like the knee that naturally lose cartilage during arthritis and aging. So research has shown that this supplement is mainly benefit for arthritis of the knee and hand.
Thank you so much, Dr. Camejo. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We love hearing from you, and our doctors are standing by. And this next one, it comes to us from Iris with our first Instagram question of the day. Hello, Dr. C and K. My mom had endometriosis, and I was hoping to dodge that bullet, but obviously didn't. I guess you could say that I have chronic pain for which I take your basic NSAIDs. They're kind of helping at the moment, but could they be doing more damage than good? And what happens if they lose their efficacy? Dr. Krichbaum, what advice do you have for our friend Iris? This is a great question.
Iris, I'm so sorry that you're dealing with this. I'm glad to hear that the NSAIDs are helping you for now. Now, sometimes with medication, sometimes your body gets used to them and it doesn't provide the same level of relief that it once did. So when using NSAIDs, if you find that it's not working as well as it once did, you want to speak with your doctor about trying a different NSAID, because often rotating to another one will help with pain relief. Now, as for using NSAIDs long-term, we'll monitor things for some common side effects like stomach ulcers or bleeding, increased risk of heart attack or stroke, or damage to the kidneys. If you need to use NSAIDs long-term, make sure you're taking the lowest dose that's effective for you, and make sure that your doctor is doing regular lab work so we can watch for any changes.
Thank you, Dr. Krichbaum. Endometriosis, that's hereditary, Dr. Krichbaum?
Not necessarily, but it can be.
Okay. Well, thank you for that. We've got another YouTube question. This time it's from Bucky. And Bucky asks, how you doing, doctors? My name is Bucky, and I think my love of hunting has inspired nature to fight back. I was recently diagnosed with Lyme disease. I guess I was bitten by a deer tick. How's that for irony? Now, my doctor told me that I might eventually suffer from chronic pain as a result of this condition. I was too embarrassed to ask, but is chronic pain like aching or burning pain? Dr. Camejo, you mind if I jump in here for a second? Just a quick one for Bucky. Bucky, you should never, ever be afraid or embarrassed to ask your doctor a question. That's what they're here for, and that's why we have to ask the doc. So, Dr. Camejo, what do you say to Bucky?
Well, Bucky, Kathy's 100% right. You never need to be embarrassed to ask any questions. But, chronic pain symptoms are, aching, burning, shooting. It'll feel like a aching, throbbing, and neuropathic, which can then feel like if it's burning or shooting or stinging or even radiating pain. For the most part, I would say that if it can be a mix of different types of pain, and if you combine any of those 3 types of pain for at least 3 months, then you have chronic pain. But let's talk about what you just said, which you were bit by a tick. So you could also then be suffering from Lyme disease. And these are the symptoms you should look out for. So flu-like symptoms, fever, chills, fatigue, any body aches or headache. Sometimes you might feel bouts of severe joint pain, stiff neck, swelling, weakness. Arthritis may occur, particularly in the knees. Now, unexplained symptoms of brain fog, feeling fatigue, dizzy, anxiety, mood swings, even abdominal pains, diarrhea, and sleep disturbances. And last but not least, neurological problems. You could have Bell's palsy, weakness, numbness, tingling. All of those are really part of Lyme disease. So if you think you do have that, and if you have been bitten by a tick, then you may want to get tested to confirm that you do have Lyme disease and get with your physician, because there are several treatment options and protocol treatments for Lyme disease.
Thank you for all that great information, Dr. Camejo. We've got a really interesting Facebook question here. It's from Mark, and he wants to know, greetings, doctors. My brother Mark has been complaining about chronic pain in his legs, neck, lower back, and always seems to be tired. This has been going on for a number of months now, and I'm concerned. He's a 25-year-old man who walks around like he's a lot older. He's not a jock, works remotely, so there's no physical reason for him to be acting like this. Could it be psychosomatic? What you think, Doc? Could it be all in his head, or does this sound viable?
Well, Kathy, it's always hard to tell without examining the patient. And Mark, thanks for sharing your story with us. We truly appreciate it. But Dr. Krichbaum, what advice would you give for Mark?
So first, chronic pain doesn't always present the way acute pain does. So some signs and symptoms like increased blood pressure, increased heart rate, breathing quickly, those aren't present in chronic pain like they can be in acute pain. So also with chronic pain, there may not be a visible source of where the pain is coming from. So it could be psychosomatic, but you want to make sure it's not a medical condition. If your brother hasn't had a medical evaluation, I would recommend that he follows up with a physician to assess his pain and functional status. It could be any number of medical conditions that are giving him loss of function in this chronic pain. And if it does turn out to be psychosomatic, then he needs treatment for it by a qualified psychiatrist.
Thank you, doctor. Okay, Dr. Camejo, looks like we got another question from the gram. This time it's from Vernon, who asks, Drs. Camejo and Krichbaum, I've suffered from chronic pain ever since I was diagnosed with migraines. I'm on triptans and they help, but I'm tired of taking medications. My doctor suggested exercise and changing my diet. Do you think a new regimen would be beneficial? I mean, I don't know anyone who likes a migraine. It's hard to focus on anything when you are dealing with a migraine. When those babies hit, it's just everything goes out the window. So please tell me there's some relief, Dr. Camejo, and would a regimen be beneficial?
So Vernon, I'll be honest with you, it's amazing what exercise and a healthy diet can do for the human body. And thanks for asking your questions. If you have migraines, you know a migraine attack can be brought on by a variety of factors. And these can include high stress levels, sleep disturbances, weather changes, and even your diet, including both what you eat and drink. So learn your triggers, track your personal food and rule out what healthy foods can be a trigger for you. Pay attention to what you're eating. Even some healthy foods can cause migraine triggers, like citrus fruits, peanuts, tree nuts, beans. All those can be a trigger. I would say always stick to fresh foods because if you eat plenty of fresh fruit and vegetables, cut back on anything that's processed. There's a lot of chemical and processed foods. Don't skip meals. That's a dietary habit that's linked to migraines. Research shows that long periods of fasting can provoke headaches. So eat small meals throughout the day. Don't go overboard with caffeine. Limit your caffeine intake, for example, drinking no more than 2 8-ounce cups of coffee or tea or even soda. Drink plenty of water. Stay hydrated because that's another common trigger for migraines. Don't eat foods with MSG. They also are triggers for migraines. And then include omega-3 in your diet, like salmon and other fatty fishes. They suggest that they help reduce inflammation and help fight those their fighting properties for that. And at least regular physical exercise can help reduce the frequency of severe migraines. And exercise does release chemicals that blocks pain signals and reduce anxiety and depression, which can make your migraines get worse if you don't. So those are my recommendations. Back to you, Kathy.
Those are fantastic recommendations, Dr. Camejo. Now, if you got questions, you know what I'm going to say. We have those answers, but we need you to call in, write in those questions. And just in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, this next question is from Catherine. A great name, by the way, so I'm sure this is going to be a great question. She reached out to us on our own beloved website, allhealthtv.com, which you just saw in that video. So you should really check this site out when you get a chance. It's really great, has great information from all these amazing and wonderful doctors like Camejo and Krichbaum. So Catherine's question is, Dr. Camejo, one of the previous viewers had a question about how one's mindset could have an adverse effect on how they feel physically. My situation is the exact opposite. I have fibromyalgia and I'm in chronic pain and always fatigued. This is having a detrimental effect on my mental health. Is there anything I can do about this? Okay, not to play favorites, but this is, I told you, it's going to be a great question. So what do you say, Dr. Camejo?
And Catherine, I'm sorry to hear about your suffering, and I'm happy to say that there are things you can do. And I'm going to let Dr. Krichbaum, this is your specialty. What advice would you have for Catherine?
So, Catherine, we know there is a lot of overlap with your mental health and chronic pain. So, chronic pain worsens things like depression and anxiety, but then depression and anxiety can worsen chronic pain, resulting in an ongoing vicious cycle that can be very hard to break. So, fatigue, especially with fibromyalgia, can have a huge effect on your mental state, as well as reducing your function and your quality of life. So a lot of my patients who have been very successful have worked with a pain psychologist, and they help them identify triggers for their pain and work on interventions like meditation or distraction techniques that helps you lessen the burden of your chronic pain.
That's fantastic, Dr. Krichbaum. I did not know they had pain psychologists for that. Thank you.
Love them so much.
And you found that this absolutely helps the patient as well?
Oh, it's been really great. I think a lot of times people believe that, oh, you're just going to tell me it's all in my head, but that's the exact opposite. We know that those things can make your pain worse. You think about if you're having a bad day and then you stub your toe, right? It makes the pain feel that much worse. And if that's your life every single day, it can be really debilitating. And pain psychologists are psychologists who've then done additional training in chronic pain management, and they're absolutely wonderful.
That's incredible. Thank you for that. Okay, we have another question. It's coming from Chauncey. And Chauncey reached out to us via Facebook, and he asked, hey docs, what are the main types of medications prescribed to manage chronic pain? Docs?
So, hi, Chauncey. We appreciate for reaching us out for your question. There are many prescription options for chronic pain, including NSAIDs like ibuprofen, naproxen, acetaminophen, and antidepressants like Cymbalta for fibromyalgia. Anticonvulsants like gabapentin or paragabalin for nerve pain, even opioids, though we use those more cautiously due to risk of becoming dependent. Now, topical medications or muscle relaxants can also help depending on the pain type and the patient-specific factors. But when starting a new treatment, we like to at least try one medication at a time and try not to increase until you're at the recommended levels. Then add additional medications as needed for chronic pain. Chronic pain often involves a multimodal approach, meaning we need to try different medications that work in different ways, as well as non-pharmacological options like diet and exercise.
Now, Facebook has these questions. They keep coming, Dr. Camejo. We have one for you. It's from Emma, and she wants to know, what are the key symptoms of neuropathic pain and how is it treated? Each person's symptoms, it may vary. So what are some of these?
So we've kind of talked about this already, but remember, neuropathic pain usually includes shooting, burning, or stabbing pain, tingling, numbness, like pins and needles feeling. Sometimes spontaneous pain can occur with or without a trigger. So pain that is caused by events that are typically not painful, such as rubbing against or having cold temperatures that cause that pain, it all depends on how it's treated. And it's treated depends on the underlying disease and condition that is responsible for most of the common medications like over-the-counters. We have already discussed about that, and antidepressants. And even there are some topical pain relievers that you can get over-the-counter as well. And you can get a nerve block, but it all depends on what type of pain you have and what treatment your physician would like to try depending on your diagnosis.
Thank you, Dr. Camejo. Another question from All Health TV. This one's from Bryn. Dr. Krichbaum, can I use turmeric for chronic pain?
Love this question. So if you're just starting to take some turmeric from your spice cabinet and put it in your daily smoothie or your yogurt, you're not likely going to get a lot of benefit for your chronic pain. So the active ingredient in turmeric is curcumin, and it gives it that beautiful yellow-orange color. However, when you ingest turmeric, your body breaks it down really quickly, so you don't get any of the benefit from it. So curcumin supplements are often made with nanoparticles or phospholipid complexes. And what this does is it allows the supplement to stay around in your body a little bit longer. And when it stays around in your body, it reduces inflammation and also reduces oxidative stress. And that can help with your pain management situation. There's also some side effects at higher doses, though, including GI upset. And it can interact with some of your medications, like if you're taking an anticoagulant. So if you are going to start this supplement in your diet, I do recommend you talk to your physician before you initiate it.
So Dr. Krichbaum, one quick question then, with the benefit of using turmeric, is that a supplement you can get over the counter, or is that prescribed by a medical professional?
Nope, you can get it over the counter at any of your local pharmacies.
Okay, fantastic. We have one time for one quick question. Dr. Krichbaum, how does cognitive behavioral therapy help in managing chronic pain? And this is from Guido, and it's from Instagram.
Wonderful. So cognitive behavioral therapy is a really, really great tool. Like I talked about earlier with the pain psychologist, this may be something that they incorporate into your sessions. So it combines education about pain with skills training. So it's this very structured approach, and it focuses on the relationships among cognitions or thoughts, emotions or feelings, and then behaviors or think, feel, act. So this includes, what are your stressors that increase or trigger your pain? Coping strategies or techniques like distraction therapy when pain becomes more intense, and evaluating your role of pain as part of your identity. And then learning how to kind of let that go so your pain doesn't define who you are as a person. So there's growing evidence that CBT can reverse some of the brain changes associated with chronic pain, including how you evaluate the intensity of your pain and reduce the perception of pain severity. And systematic reviews have shown improvements of depressive and anxiety symptoms with patients with chronic pain who are using CBT.
Extremely helpful. I can't thank you enough, Dr. Camejo and Dr. Krichbaum, for taking time out of your very busy schedules to join us here on Ask the Doc, and we'll hopefully be seeing you soon. And to all of you, that's all the time that we have for today. I'm Kathy Buccio, and I'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.